I talked to him on the phone console. As he's talking, he's like, I'm gonna kill myself. If you just stayed for a couple of weeks and gave me a real shot, we can make this significantly better and probably save your life. Adhesion is the most common condition in the musculoskeletal system. An EMG or NCV will catch a nerve that's damaged when it's like 90, 100% bad. There's nothing catching it between 0% up to that 80 or 90%.
Time to sit down, keep it real, and cut the bullshit. Welcome to Table Talk. Okay, guys, we're back with another episode of Table Talk, and I have Dr. Chris out here. We'll get more into your background and your story and all this other kind of stuff here in a second. What I want to jump off with is you just did some work on me, which was in a video that we posted last week. Neither of these are posted yet before, but we post that beforehand. Then the podcast afterwards. So with that, you asked me some questions via email. What were your expectations on what you thought I was going to physically be? Yeah,
I didn't have much expectations. You've had this shoulder pain since a little before 2000-ish or before, and your MRI from 2004 said severe degeneration in the glenohumeral joint, the AC joint, diffuse labrum degeneration, supraspinatus degeneration and tear. You got neck degeneration, you got thoracic spine degeneration, and you just put your body through a lot, like a lot of us athletes. So it's always...
I have 2 replaced hips too, so I just conveniently left that out.
So it's always just taking this stuff with a grain of salt. And I sometimes when people find us on social media, they're expecting miracles, and we do often perform a lot of miracles with people, but I don't want people to expect like they find the solution and it's just guaranteed that they're going to be so much better. But the good news is today we found a bunch of adhesions and nerve entrapments in your body that my expectation today, we made some changes in your ranges of motion and your tests. And my hope is that you're going to feel some type of capacity or symptom change where maybe you can sit for an extra hour before those symptoms start coming up your neck, or you can put a little bit more load on your shoulder joint before it starts getting pissed off. And then in the future, if you end up wanting to get more adhesions removed, you at least know that there's hope and there's possibility of further pushing off this potential shoulder replacement.
Now, your area of specialty is in pain management, right? Or not pain management, but pain. How would you explain it?
Yeah, non-surgical chronic pain relief.
Yes.
My special sauce, myself, and then also the providers that we train, we're working to be world-class in manual therapy. So if anybody can be fixed with manual therapy with chronic musculoskeletal pain, that is our intention. So non-surgical chronic pain relief is how I would describe it.
So how would that, I caught myself when I said pain management, because there's a whole other sector, which I've been down that sector too, which we'll just not talk about that sector, because it's, in my opinion, worthless. And even more worthless today because the meds are harder to get.
Yeah.
There's more, they're more controlled with the meds than before, because before it was just kind of like, here's the meds, do this. And then you'll have a sector which would be orthos that are non-surgical. Yeah. And then you'll have the holistic sector where I guess you would kind of fall in like the chiropractic holistic sector, but then you're focusing in just this one area, which is chronic pain.
Yeah.
How would you define chronic pain?
Yeah, that's a great question. Chronic pain is pains that don't go away. So it could be that's lasting longer 6 months and it's been consistent over those 6 months and it's been there for months to years. But also chronic pain to me is I've had a pain 5 years ago, it went away, came back 3 years ago, went away, came back 1 year ago. The most common thing we treat by far is low back disc problems. It's the most common human musculoskeletal pain problem that could have. So typically people will have, when they're younger, they'll have episodes. It'll be a shorter episode, it'll be less intense. Then they'll have another episode 3 years later, it's longer, lasting longer. And ultimately it gets to a point where now it's not episodic anymore. It's just there all the time because it's degenerated to that point, and they have enough adhesion, and they're also weak to the point where now the pain really is chronic. But chronic pain can start as episodic. It's infrequent, but it's still there, which suggests that there's some type of problem, and it's only coming out when something overloads it enough to bring it to attention. It's surpassing a symptom threshold at which the capacity isn't there, the body can't handle that amount of load, and now it's being stubborn. So chronic pain is lasting for a long period of time, usually 3 to 6 months.
All right. I have several that are just kind of like random questions I wanted to throw out there that I just have personally have before we really kind of get into all this. And that was one of the first ones, is chronic pain, because I like to define things, right? And that's kind of like if a trainer is working with an athlete and says, I want you to train at this RPE of 7, like everybody gets what that's supposed to mean, but how do you anchor that?
Yeah.
And like chronic pain is one of those things where my chronic pain could be different than yours and different than somebody else's. And it's your job to be able to identify what that means for that person.
Yeah.
And so we'll get more into that as we kind of move forward. But the other question that I always have when it comes to pain, and pain being different than injuries, like injuries, acute, you have rehab, all this stuff kind of go from there. Pain being this, as you just described, lingering type of thing, also can come with an identity, where people will identify as, my back's always fucked up, right? And then they can use that, for advantage, or whatever. I could use my shoulder as all kinds of excuses, I don't. But I know a lot of people that this is the question though. I think they begin to identify with the pain, right? Then the pain becomes like part of their personality. Yeah. And then when you go to try to work with said person, you're dealing with two things.
Yeah.
You're dealing with, you're always dealing with the brain because everything's coming from the brain.
Yeah. But
now you're dealing with this, for lack of better description, personality disorder, because it's so locked into that, which, how often do you run into things like that?
All the time. Pain is something that, in business worlds, they talk about when you're selling to somebody, you address the pain. So from our perspective, from a business perspective, we're addressing actual pain in order to help people. And pain by definition is something that negatively affects most people's lives. And so to the extent that it's negatively affecting somebody, it's causing some type of suffering, which I would describe as resistance to the pain or an emotional attachment to the pain, then it negatively affects what they're trying to do. And so for your audience is people who are powerlifting. I'm an ex-athlete, so college football, played rugby. I owned a CrossFit gym for a few years. It was preventing me from being able to do the thing that I love. So then it becomes something in my brain like, shit, I can't do this thing. For some of us, I know it was for me, fitness and sports were my addiction. So then if you're talking like I can't do my relatively healthy outlet in order to do the things that I want to do, now I'm suffering because I'm not living the life I want. Then when you take that away, if people can't do the things they love that they want all the time, but now they have pain throughout the day with their activities of daily living, now it's negatively affecting other stuff. So with a lot of our patients, it gets in the way of their work. They can't do their job as much as they want. Worse than that, it negatively affects and impacts their family, their husband or wife, their children. I have people come in with their partners or their children, and they're like, will you please fix them for me?
Yeah.
So I want them to be better, but this is costing me now. It affects circles outside of that individual. So the pain, the identity comes from my perspective, the resistance to the pain, wanting it to be another way, and then the emotional suffering that is attached to it.
Well, it just made me think of something that I kind of always knew. If it's a top athlete or an athlete that is in the sport so much so that they identify as that sport, right? That sport, CrossFit, powerlifting, whatever it is, becomes their identity. And then the injury puts them out, which injury or age is going to, put, or other hobbies, injury or age, right? It's going to put pretty much everybody out. Now they're dealing with two different identity processes going on. They have the one that they're trying to figure out who they're going to be without CrossFit, powerlifting, or whatever it's going to be, because that's all they know. Or football is a good example. They play it all the way through college as you did. So it's just, you start as a peewee, it's 15 years. You know, who are you if you're not the football player anymore? That's removed, but then it was removed because of some main injury that you can't come back from, that then follows with pain that's associated with that. So now there's two, you know, I'm the washed up, you know, football player with the fucked up knee that can't walk right again. And then they got to try to, so yes, of course, that's going to impact everybody else in their life. This is at the highest end. Yeah. Right. But at the lowest end, that's what just popped in my head is, oh shit, there's a whole nother a whole other identity crisis for somebody to have to deal with, as well as employment and everything else if it's their sport and they're getting paid to do the sport. So there's all that. But at the lower end level, it's most of the people. God, there's a lot of questions that I have. They're just random. You get a lot of the people, because I hear a lot of the sales and the marketing that comes from all the fitness industry. And a lot of it is, well, you want to be able to play with your kids again, all these other things. And if it's somebody that has chronic pain, that has been working around it, you know, to be able to deal with it for 10 years, right? They've already learned how to not get on the ground and play with their kids. You know, so a lot of the sales stuff that I see go out there, I'm like, do you understand that this person probably hasn't been on the ground playing with their kid for 6 years, and they can't even identify with what that actually is, where if you back it up a little bit, them just being able to sit and move without pain, you know, or get through more than half of the day without pain becomes another one of the, you see the same marketing that I do. It's like it's everybody's fucked up because they're hunching over devices all the time, which I think's bullshit. But it plays a role, you know. 100%. You know, it's the reason why I've always said I think that's bullshit is because everybody wants to go back to the days we were all cavemen, sitting around fires, hunched over, right? Then we get into the industrial age where we're all working on assembly lines, hunched over. It's been the same sales pitch, just formatted differently over all the different years, where I'm sure it's a part of it, you know, but there's more going on, just the lack of moving and so forth, so I just kind of want to rant about all that. So getting back to some of the other questions I had, where what you did with me was adhesion release, right? So what are all the modalities that you use now, right? As I go through your timeline, we'll get into modalities that you use to come to what you use now. But when I see practitioners that do what you do, there's I think I can curse now. There's a fuck ton of modalities, right? And there's, I don't know if there's new ones being invented, but they're being recirculated over a period of time. And I think the younger ones coming through, if it's kind of like training, need to play with all of them, you know, to kind of figure it all out. But then they usually land, you know, on something. So after all the years of you doing this, what are the modalities that you've landed on that you hyper focus on now?
So I'm going to take a step back. I'm a chiropractor. Initially I played college football. I was like, okay, I'm going to chiropractic school. I'm going to go be a chiropractor. I wanted to work in the NFL. I loved New York Giants. I wanted to work with professional athletes. I started getting I had little chronic pains, not lasting, sustained chronic pain, but it would just show up here or there, like consistent in my low back. And I remember I was starting to get adjusted, and I was third, fourth trimester, and I was like, this isn't fucking working for me. If it's not working for me, can I morally do this for other people in a way that I feel like I can serve them and make money from doing this? And so I really was looking hard for modalities that I could hang my hat on and say, I'm providing a good value or service. And I was looking around a lot of stuff, and I was thinking of quitting chiropractic school for a while. I got lucky. I attended one lecture by my mentor, Dr. Brady from Integrative Diagnosis. He gave a lunchtime lecture. It was the only one he gave. And he said, how many of you are taught you can fix everybody with chiropractic adjustments? We all raised our hands. And he's like, I don't believe that that's true. However, I believe that you can help some people better than anyone else is helping them. And that was through the diagnosis and treatment of adhesions. So he treated my psoas, and I had more longer lasting relief than I'd ever had before. And I was hooked. And I jumped straight in and I started focusing on this adhesion stuff. He's like, look, be a scientist when you graduate. You want to keep adjusting? How does that affect your outcomes? Is it doing better? Is it doing worse? What is it doing? A few years of doing adjustments, and I was like, I don't think that I need this. And so I dropped it. And this world of adhesions is such a robust world of being able to fix complex pain at deeper and deeper levels. I'm still not as good as I'm going to be 5 years from now, 10 years from now, 20 years from now. So Adhesion Release Methods, which is the system that I co-founded, it is the diagnosis and treatment of adhesion. And I don't think that there's any other treatment system that is focusing on this pathology. So that's the primary modality that we use, which is how do we treat these things? 80% of the time with our hands, 15% of the time with radial shockwave, and maybe 2% of the time with that little metal grip bar that I gave you for some myofascial areas. Stepping back from that, the next piece to what we're doing that we're teaching other doctors and therapists to do, and especially focusing on massage therapists who technically aren't able to diagnose, but we're still teaching them how to critically think, is how do you diagnose somebody? How do you figure out what their problems are so that ideally you have a diagnosis? If somebody's in chronic pain, their chronic pain is going to be, it's not going to be just one thing. It's going to be maybe 2 or 4 major areas that they have problems with. One of them is the joint degeneration bucket. One of them is going to be the weakness bucket. There's going to be the adhesion bucket. There's going to be the metabolic bucket. What's going on with do I have an autoimmune condition? Do I have a thyroid problem? Whatever. There's going to be the stress emotional bucket. Do I have trauma? Do I have something like that? Those are the primary buckets. Then when you have a specific problem, you take one part of that problem, and if you put the gold standard solution for that piece of the problem, you can start to make real impact and outcomes that last in fixing somebody. This usually makes sense to most people who aren't doctors or therapists, but a lot of doctors, especially chiropractors, don't. Just like, oh, whatever your problem is, I'm going to adjust you. Mm-hmm. And that's not quite the way that it works. So this goes to all of medicine. Like if anybody has an autoimmune condition or some other thing, what are the problems that are contributing to that, and how do we get those things better? And so if you can be really nuanced with which solution is going to which part of the problem, you can fix people. So the primary modalities we use are the diagnosis and treatment of adhesion, and then strengthening after that. And then we will refer, if there's a metabolic problem, that bucket, metabolic specialist. Emotional problem, emotional solution. Degenerative problem, yes, I do refer people to surgery. Most people should get their adhesions fixed before they get surgery, because a lot of people won't need surgery after that. But even if you get the adhesions removed before they get surgery, they're going to recover way faster than anybody who doesn't get the adhesions removed. I did a video a couple months ago about 100% of people who get hip replacements have a femoral nerve entrapment in the front of their hip. And I had a guy fly out from Ohio, and on the consult, he's like, is this for real? Blah, 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 blah. He flew out. The second day he came in, he's probably your age, maybe 55. And he gave me a hug. I hug all my patients. He didn't let me go from that hug for like 30 seconds. And he started laughing at me. He's like, I'm 30% better. And I had treatment yesterday. He went home. He came back a couple weeks later. He was 40% better overall. He's like, they want to do an ablation. And I was like, no, it's not going to work. You'll get temporary relief, and the nerve's just going to regenerate, and it's going to come back alive, and it's going to be pissed off again.
What's an ablation for the
hip? They burn the nerves.
Okay.
They burn the nerves. So the point of that is his problem does not warrant needing ablation. I don't necessarily know what problem warrants needing ablation.
That's what I'm trying to figure out in my head.
A good treatment should be reducing some type of pathology to the extent that it can be reduced. If all the problems can't be reduced, then by all means do pain management in as healthy a way as you possibly can. Smoke cannabis. There's some type of healthier opioid, sure, do that. But most doctors or therapists aren't necessarily putting people through a diagnostic critical thinking process in order to figure out what the solutions are. And then they have to be equipped with what tool do they have that's the sharpest, best gold standard tool for that part of the problem, and how do they work that out, and then use the other appropriate professionals with their tools in order to significantly help somebody.
Are you feeling like you're not the man you're supposed to be? Low confidence, negative thoughts polluting your brain? That's me. I get it. I've been dealing with messed up hormones most of my life. A couple years I hooked up with Merrick Health, and it was one of the best things that I ever did. They're a health optimization platform that does advanced lab works and goes deeper than probably what you've ever seen before. What you'll get with Merrick Health is they have guided optimization and the self-service diagnosis. I personally have been using the guided optimization for the whole time I've been with him. Dry is my health coach. He does an amazing job. The second route that they have is the self-service diagnostics. This is just a DIY with your own health journey. You just head over to Merrick Health, pick the panel, and they'll send you the report. You just kind of go from there. Either way, I highly recommend them, and you can get 10% off right now. Just head over to merrickhealth.com and use the code TABLETALK at checkout. So with your manual part of this, how is this different than ART?
Mm-hmm.
You know, which active release therapy, for those that don't know.
So I would say that we are 2 steps evolved from ART. My mentor, Dr. Brady, who I just mentioned, he was an ex-ART instructor. He went to Dr. Leahy, who founded ART, and he said, you can't get to longest coli lives in the front of the throat. You can't get to longest coli from lateral to SEM. You have to go medial to SEM. Dr. Leahy said, that's cool. We're certifying 200, 300 people a weekend. We're just going to keep doing it the way we're doing. So Dr. Brady said, okay, I'm done here. I'm going to take the top 5% of people who want to be ART providers, and I'm going to make them the best in the world at manual therapy. So that Dr. Brady started integrative diagnosis from 2008, retired in 2020. And so he taught probably a handful of 30 to 40 of us over those 12 years how to be the best at removing adhesions, because ART started with focusing on adhesion in individual muscles and nerves. Dr. Brady just took it to the next level. Adhesion release methods, which I co-founded starting January 2023, is the next step evolved from that. So it's just more specific, it's more precise, there's a diagnostic system, it's taught differently. ART does this whole ART handshake thing where when they're getting into tissue, they're rotating the hand. You can't do that. You have to sink into tissue first, and then you have to apply a tension vector right in the exact spot where you need to break the adhesion. So the technique is very different. When people know ART and they see our protocols online, they're like, oh, you're just bastardizing, you're just stealing ART. I'm like, you don't know how it's taught. It's taught extremely differently. Our providers are not doing 1 training per year. They're training at least 4 to 6 times per year to develop their feel and to continue to develop these principles that we talk about how to treat these adhesions. So it's a different, we're teaching how to swing a golf club differently from my perspective, and I think from a lot of our patients who have gotten ART and ARM, in a very different way.
I've had a lot of different modalities done over the years, especially while competing, right? Because it's the competing mindset's different than the post-competing mindset. The competing mindset's just fix the shit so I can go break it tomorrow. Like, it's not even fix it. Just get it ready for me to break again. And with a lot of these modalities that I've tried, and you know, ART being one of them, I've seen, and this is an outsider looking in, so everybody take this with a grain of salt. I've seen this migration of each one of these, including MAT, which is another one I did for a long time, and Rolfing. You know, I can go through a whole list of all those. And if I go way back to my first introduction to, say, ART, I don't know if muscle testing was involved in the beginning or not, right? But at some point, I think it, at least with Dr. Leaf, I think it became a big part. I'm going to guess it probably always was, but a lot of the practitioners I saw were just like going in on it. And it's going to sound kind of weird the way that I say this, where the first treatments of usually all these things hurt, right? And to me, that was wrong, but a good thing,
right?
Like this hurts like a bitch, so it has to work, right? And then the longer I would stay with one practitioner, the method, right, according to the practitioner, which I could be wrong, changed to where, well, it's not supposed to hurt like this. And I always kind of thought, no, I think what's happening is you're getting too fucking worn out, by working on somebody that's carrying 280 pounds of muscle, that you're trying to find some other way around this so you can still work on the other people that you have for the day. Because if it's me or one of the guys I was training with, we're wrecking your day because of the force that they would have to apply with their fingers and so forth to be able to do it. And every one of them did the same damn thing, to where what starts off as being, and this is from the meathead side, what starts off as being, wow, that hurt like a bitch, but I thought I was ready for there's follow-up. I thought I was ready for the next session to, like, what am I even doing? Like, this now is no different than a sport massage I'm going to get on a freaking cruise ship.
Yeah.
So how are you preventing that from happening with the people that you're working with?
Yeah.
Granted, not all your patients are going to be like this.
Yeah. So I find that I owe an enormous amount to ART. And so I just want to say, there are some good ART providers. ART gave so much, but I was full body ART certified. I have problems with my hands. I was a middle linebacker in college. I was 180 pounds. I was Division III, but I'm still hitting 250, 300 pound fat linemen as a 180 pound middle linebacker. And so my hands would get taped and they were always swollen. So for 20 games in college, my hands would be swollen for 2 days before it would calm down. So I had pretty bad degeneration in my hands. When I was doing I wasn't really good at the adhesion stuff yet. I was doing integrative diagnosis, but I was still doing way too many passes. Why was I doing so many passes? I didn't have the feel that I needed to have. I didn't have the feedback that I needed to have it. And so I was just throwing the spaghetti at the wall, the kitchen sink at people, hoping that something would work. In my experience, when an ART provider comes over to ARM, they're doing way too many passes, not being specific enough on where the adhesions are, and not having we call it PRP. PRP is also platelet-rich plasma, it's the feedback, the provocative tests, the range of motion, and the palpation that tells you that something is different. So in an ideal world, I did this a little bit with you today, but I'm usually only doing 4 to 8 treatment passes per visit. So if I'm doing 4 to 8 treatment passes, I might do 1 treatment pass, have them immediately get up and do a retest, and then I'll do a second treatment, 1 treatment pass, a second one, immediately retest. So I'm much more present and mindful to what I'm feeling, what I'm doing, and focusing on what should be better or what should be different. And that's causing much more focus and precision as far as what I'm doing in order to break an adhesion. If there's an adhesion in a specific spot, I'm not trying to do I'm not going to do the entire nerve tract from the neck to the armpit to the arm to the median nerve to the hand. I'm going to find 1 or 2 or 3 spots that need to be relieved today and see how things change. I expect 50% of the time, somebody's going to have some type of sustained relief after the first treatment. 80% of the time within 5 treatments. If somebody's not have any relief after 5 treatments, something is wrong or off. Sometimes I'll keep going to visit 10 or 15 if I have really good reasons for doing that and I'm fairly confident. We charge $350 per 15-minute visit in New Jersey. I can't do that unless I'm confident that I know what I'm feeling, what I'm doing, and I'm certain on the diagnosis, and I'm certain I can help those people. So it's really just a matter of how we are focusing on using our data, our testing, our ranges of motion, our feel, our palpation in order to make things better. And if the tissue is not feeling softer and I can't move the nerve or bow the nerve easier immediately when I'm done, I didn't do shit.
Yeah.
So, and I can't go to a court of law and say, hey, I did this and I was sworn in and they needed this. Otherwise, then I'm just, how could I be honest with myself? I'm lying to myself. I'm lying to them, lying to everyone else. So I think that some of the ART providers or the other providers don't necessarily know any better, or don't have a system to help them focus the treatment in a way that is productive.
I will say, and I probably should, that with all the modalities that I've talked about, if it's, MAT, ART, massage therapy, trigger point therapy, muscle test, apply all these different things. There are excellent providers in
Yes.
all of them,
Yes,
right?
agreed.
And those are the ones that just are absorbed by it, and double down on all that and look at other modalities to be able to bring it into their template, I guess is what it would be said. What I noticed with what you did, which is rare, is the pre-testing, was more extensive than the majority of the people I'd ever see, just to kind of the diagnostics, I guess you would say. And then the other one you're probably not even aware of is there was no suggestive language after I got off the table, right? So that's like a secret in the whole industry is you get off the table and it's like, wow, you look like you're moving greater. Wow, look at the change. It's all this suggestive stuff where I've seen the extremes of that to where it's almost to the point where it's like, just dude, shut the fuck up.
Yeah.
But a lot of people will fall, for that. And I tell people that if you want to know if it's a provider that you're going to stick with, pay attention to that.
Yeah.
Right. Because that seems to be like one of the biggest clues, for me. And it happens way up on the price scale and way down on the price scale as well, to where it's like, really, so it's, but the diagnostics can be tricky because with yourself, I'll just keep it this way, or the people that you're, is it certification? Whatever you want to call that. Is there packages? There's because if you have somebody that's going to see you once, you can't spend your whole time doing diagnostics. You get what I'm saying?
Yeah. Well, so first, note the third time you did your shoulder range of motion, it got worse.
Yeah.
And I said to you, it got worse.
Mm-hmm.
Then when we did the cervical testing, all 3 tests, I told you all 3 are worse.
Mm-hmm.
And I said those words. I was like, okay, you're worse. Usually that means in this context with severe degeneration that I did too much load. You're going to be fine. You're going to recover. You can handle some symptoms or pain. So patients want to like their doctors or therapists. And so Kate, who's with me, she's our CA, people will be doing testing. And I'll notice people, how is it immediately after, how has it changed? And they'll be going like this. I'll be like, is it fucking worse? Mm-hmm. If it's worse, say it's fucking worse. I need you to be objective here. I am a robot that's here to break your adhesions and tear them out and to help you get better. I don't need you to fluff this up and to make it seem whatever. You need to tell me, if I'm making you worse, if you're not better after 5 visits, we need to stop, because we need to figure out where the next doctor or therapist you have to go or how we fix this thing. So there's a place for suggestion. There's a place for placebo. Usually with the chronic musculoskeletal pain people, unless they're very spiritual and like into meditation and understand placebo very well, I'm usually not going to go there. But there is a place for it. But yes, with most of our patients, we have packages. So we'll do the exam, the whole process, and then they come in for 15-minute visits. They report into Kate for 2 minutes. They'll do some tests. We'll treat and retest within 15 minutes, and we'll keep going from there. If they're flying in, we'll usually have them stay for at least 3 to 5 days. So we just get as much value as we can. I do have people flying for 1 day, and I'm like, really, just 1 day? And then they just do the best that they can. But I tell them that I might lose them to this type of care when it could help them if they got 5 to 10 treatments. And they might say, I got 1 treatment and that adhesion stuff's not for me. And to me, that's risky and dangerous, because most people, it can help if they just give me an enough shot. But if I have a patient with 10 years of pain and they expect 1 visit to get better, I had a guy, he's one of my favorite patients ever. Last spring, he called me, Al from Tennessee. He's like 62 years old. And I talked to him on the phone consult, and as he's talking, he's like, "Yeah, I'm not gonna take this much longer." And I was like, "What do you mean?" He's like, "I'm just gonna do something about it." I was like, "What do you?" I knew what he meant. I was like, "What do you mean?" And he's like, "I'm gonna kill myself." And I was like, "Okay, thank you so much for sharing that with me. I really appreciate it." He told me, he's like, "Yeah, I'm coming up for 3 days," and I was like, "Al, this makes no fucking sense. You're going to kill yourself after 3 days of treatment, when if you just stayed for a couple of weeks and gave me a real shot, we can make this significantly better and probably save your life instead of just coming for 3 days. What else are you going to be doing if you're going to be dead?
Mm-hmm.
Long story short, he stayed for 2 weeks. He came back a couple months ago. He's still alive.
Mm-hmm.
So like 80 or 90% better, had failed low back syndrome surgery in 1993 or whatever. So I just had to reframe him because he thought like, oh, I could just come for 1 or 3 treatments. You've been having adhesion. You had surgery, so you have scar tissue, literally. And then you've had 30 years of living with the scar tissue and all the compensation. There's lots of layers of adhesion. And so people just have to understand that it took a while to get here. And so sometimes it's going to take some time to get better too.
Yeah. So you said that you were an athlete when you were younger, then you played football in college. When you were in college, what were your aspirations post college? Because you had a gym for a while, right?
Yeah, when I tell my son, because my son wants to be an archaeologist, in 2nd grade, I wanted to be an American gladiator, a professional football player, or a veterinarian. So like that's what I wanted to be when I was a little kid. So I knew I wanted to help people or animals. I really liked football, and I liked fitness stuff, American gladiator. So when I was in college, I was torn between like business or some type of doctor healing. My grades were not good to go to med school. So I can't go to med school. I'm just going to be a chiropractor or work professional football. And I just knew that I wanted to help people and have impact. But it really was.
Well, back up for a minute. Why play ball at Division III? Because typically there's no scholarship.
Yeah. No.
So it's
right.
I was in that situation to where it could have been that.
Yeah.
And I'm like, I'm powerlifting. Like this is just gonna fuck me up. Like what's the benefit? So why did you decide to keep playing?
Yeah, dude, football, fitness and football. I struggled with depression and suicidal ideation as an adolescent, as a kid, and I started in 7th grade. I just moved back in with my dad after my parents got divorced, and the divorce fucked me up really bad. A lot of shame, a lot of self-hatred. I took that on myself. 7th grade, I started going to the gym every single day. And so the gym every day, and then I played football. And so doing that, and I wasn't even good until senior year. I finally started. We won the state championship at West Essex High School in New Jersey. And then all my teammates, some crazy white Italian kids, like really good, very violent and physical. I love that shit. And like that was one way I could hurt myself. I could hurt myself by throwing my body at you. I'll get laid out.
Well, you're also expressing your aggression.
I was big time, huge release. And so my football coach in high school, after the season, he's like, okay, you're going to go to Franklin and Marshall in Lancaster, Pennsylvania. It's a Division III college. Why don't you play? I was like, I'm not good enough to play. He's like, yeah, you are. So I decided to go and play. And then all my friends at college got recruited. It's Division III, but they still got recruited. I walked on. But because
so was that team then worse than your high school team?
So my football football coach in college looked at film from high school and he's like, "You don't look like a high school team. You look like those kids."
Well, state championship, right?
They were fast. They were fit. They were physical. We lost one game my senior year. We shouldn't have lost it, but we crushed a lot of teams. The team we beat the state championship, they had 2 Division 1A players on that team, and it was all just about controlling these 2 guys. But we just, because of the culture of discipline and hard work, our our coaches were really good guys, and because in Fairfield, New Jersey, there's the kids are playing from a very early, so we were all playing together for a very long time. Mm-hmm. And then in high school, the culture was we all worked out, we were very physical. Ray Nitschke, I think he was a Green Bay Packer, but they had a thing at the Green Bay Packers called like Bloody Tuesday or something. I don't know if this was the other guys or just me. It was 20 years ago, but like on Tuesdays we fucked each other up. Mm-hmm. Like that's what we did. So because I had this whole experience of like football and fitness being my outlet, and I didn't start drinking. I drank in 7th grade. I stopped. I started drinking in 12th grade, but football and fitness was my thing. So in college, I'm like, okay, this could still be my thing.
Yeah.
And thank God it was, because I was okay starting as a senior in high school. I got better And I was also a year behind my teammates in high school, so they were a year older than me. So I developed slower, and I'm also small. So freshman and sophomore year, they moved me from cornerback to safety to nickel back to corner. I ran a 5.040. It was too slow.
Mm-hmm.
And so I got a new coach my junior year. He was like, "Do you want to play middle linebacker?" I was like, "Yup." So
Mm-hmm.
I started as a junior. I started as a senior. I was captain as a senior. I was team MVP as a senior. I was first team all conference as a senior. So thank God I learned all of this from playing college football, because I didn't really see how good I can get with hard work, because high school I didn't have enough time and wasn't big enough. But as I developed physically and I kept working out, that's what allowed me as a senior to say, okay, I'm 180 pounds middle linebacker, but now I can fuck shit up.
Mm-hmm.
So it taught, like, people ask me if I'm going to let Bear and Koa, my sons, play football, whatever they want to do. I have some chronic pains now because of it, but I learned so damn much about teamwork and about hard work and personal effort that I wouldn't take away for the world.
Mm-hmm. So when did you decide then, like, what did you graduate with?
I was pre-med and a biology, major in biology.
All right, so you did find at some point that you had a brain.
I'm probably relatively smart. I'm not as smart. I was drinking a lot in college between off seasons and stuff, so I was good enough to coast through, and that's why I didn't really push myself to like get to be able to go to med school. But I knew that I liked health and that I liked fitness, and I like learning about things that allow people to feel better and be better and suffer less.
Did you know that you wanted to go on to chiropractic at that time?
Yeah, because I saw my parents get adjusted, and they always went and they always liked it. And then I also knew that the Giants had chiropractors, so I could be around football if I went this route.
Interesting. Oh, I'm laughing because you're taking, that profession. Then you're taking. How many chiropractors are in the NFL?
I mean,
right.
a handful.
A handful,
Yeah.
Right? And like that's what I want to do, which is big aspirations, which is a good thing.
Right.
And so you went into it with the mindset that you wanted to work with athletes.
Yes.
All right, and then you get into chiropractic school and you find out that it's not going to be the case.
Yeah, I mean, I got a little bit, and then also I'm the chiropractors I know who are on NFL teams. First, a lot of them stopped. They don't get paid really well, and the athletes don't really appreciate it or care. And it's hard to do really good work with those athletes because they just beat themselves up again, like you were saying. And I realized that I was more focused on impact, and I also realized I suffered more in college. So some of the shame stuff, especially around females, got really bad. So I was just suffering a lot, and then somehow I got focused on like, how can I really impact people? Like, how could I take somebody who is suffering immensely and have them not suffer immensely so that they can be somewhat happy and not won't want to die or kill themselves.
When you were playing, right? Because it sounds like there's in college there's two of you, right? So when you were playing, did they have a nickname that you went by? Every fucking player has some nickname that
I can't think. They just called me Steppy.
All right, so Steppy, right? So you have Steppy, which is who you are in the field and who you are in practice, right?
Yeah.
Which is the one that's confident, that's strong, that wants to fuck people all up, right? Then when you're not there, then you're Chris, right?
Yeah.
So you have these two, kind of battling personalities.
Yeah.
At what point were you able to make those one person?
Yeah. People do tell me I'm way too intense sometimes. So on the football field, I was aggressive and violent and like in your face, and I'm extremely introverted. I'm extremely quiet and shy. I cannot talk. If I'm with people, I cannot talk for a period of time. I'm driving here with Kate, and like we can just be quiet together. And so there's all of that. When I'm like doing my thing, I can be relatively intense. So I bring the intensity comes like when I'm talking to somebody, or how I bring the impact, or when I'm teaching the other providers, or if I'm creating content. And so it's the hard part about that though is I have to be, if I'm not feeling good, and I would describe feeling good as like high energy, probably norepinephrine and dopamine and all those hormones in my body that allows me to do that. But if I'm my regular mood is probably low, pretty low negative affect. And so not being able to work out from having these chronic injuries over the years has been a major problem, which is why I've had to explore other ways to keep living in a way that I'm present with the people who need me and I'm able to love and serve people the way I want to. So I want to, and I try to bring the intensity. It's very needed with content, speaking to somebody from like, I'm going to be effective from what you need to hear and change your behaviors or whatever you have to do. But I'm just not always able to do that when I'm trying to learn how to do that without getting the high of being able to work out like I did all my life.
Yeah. Well, it's a weird thing because I'd have just personally, I have this zippy personality, which is, the personality that, is the max effort, in the gym, just
Yeah.
fuck it. If I die, whatever.
Yeah.
Right. And then there's, Dave, the other side. Right. And it's, I used to call it like blast and dust. And there's all these different things where, the trick is, how do they breed, so they're both there all the time because one leads. Right. And say when you're playing in your college, there's times where that just the player leads. Right. And the other one's suppressed. And when the other one's suppressed, the other one is not expressing themselves, which is actually you. Right. Yeah. So a big part of you is not expressing themselves. So that big part of you is going to be in bad places.
Yeah.
Right. But the other part can step up and say, look, I got this. Right.
Yeah.
And pull it back out. But the fact of the matter is we still have one brain. Right. So they got to be able to come together where it's almost like you got to take the one that got you through all those whole bad times.
Yeah.
Say, okay, dude, you can go on vacation right now, but don't go too far.
Yeah.
Right.
Yeah.
Right. But thank you for what you did.
Yeah.
Right. Because in many regards, it kept you here.
Yeah.
Right. Or thank you for all that, but let's build up the other one. Right. Then the other one gets built up and it's a balance, right, that we kind of all go through. And it ties back a little bit to earlier when I was asking about when pain can become, one of those identities. It's kind of like that same thing.
Yeah.
Those people will have that one person that will go through hours and maybe even days and not have any pain.
Yeah.
Right.
Yeah.
Because they're in this different mindset, different zone or whatever it is.
Yeah.
And then as soon as their spirit, because we come from our head and we come from our soul.
Yeah.
Right. And they're kind of separate. Where a lot of people lead with their head.
Yeah.
Right. And a lot of people just lead here.
Yeah.
And they make a lot of really dumb decisions.
Yeah.
But you really need to come. I think you need to come from here.
Yeah.
Right. And then this kind of helps with that decision to be able to kind of mold all that together where we're all humans. We're all kind of trying to do that, through the whole time. And so once you graduate college and you get out, then what was next? So now you're practicing as a chiropractor. Is it your own practice or are you I assume you're under somebody else?
Yeah. So, well, I went to chiropractic school. I graduated and I moved down with my girlfriend at the time to Asheville, North Carolina. And I was going to team up with a good friend of mine, Dr. Corey Duvall at Stay Active Clinic in Asheville. He taught me so much about fitness. He was a mentor of mine. I actually just talked to him 2 days ago for the first time, like 5 years ago. And I like to surround myself with people who are like very high standard, and he was researching and studying and connecting dots. He figures shit out. So I was like, oh, I can work with this guy and the two of us can be together. I ended up breaking up with my girlfriend and then it didn't work out with Corey. We're still very friendly, but then I came back home to New Jersey. I just started my own practice. This was May 2010. So I'm never really one to work for others. I think now I could actually work for others, having failed so much with the right type of leader. But I just started off on my own in a CrossFit gym. So I went to a bunch of CrossFit gym owners because I knew they had good community and I liked that aspect. So I went to CrossFit owners. Can I treat you? Because I knew if I could treat them and offer value to them, that they might be willing to have me come in their place. So I met 3 of them. One person I really helped. She had a really good community. She let me set up her practice there. I started treating on the floor. Then she gave me this little, it almost looked like your bathroom right there. Like she gave me a little closet where I could start treating. And then a couple years after that, I was like, okay, I need to go and start my own CrossFit gym. I want to see what I can do. So yeah, I just pretty much started on my own besides those 2 months in Asheville.
Now at that time, was it just chiropractic with no other modalities?
It was chiropractic. I was doing some of the adhesion stuff, ART / integrative diagnosis, and then it was strengthening. So it was, I'm going to use CrossFit type motions or some type of rehab stuff to get there in order to help people get active.
Okay, so you were integrating in
Yes.
the strength work,
Yes.
which is something that a lot of the, across all of those modalities, a lot of the practitioners, it's better today than it was before. So that was integrated in early. So then why did you decide to, instead of just building the chiropractic practice, open the CrossFit gym?
I'm an idiot. But I had my too big of a head. I thought that I could do everything, and I was just trying to do all of my goals all at once. And the 5 years of the CrossFit gym, I learned a lot. Massive failure, lost my dad's money. One of my business partners, extremely stressful, not a healthy situation. At one point, he was screaming at me in my office while I'm treating a patient. And my dad was a Vietnam vet. He comes in behind this guy, grabs him by the neck, and drags him out of my office. And the police came. So I was rubbing this guy the wrong way because I was trying to lead and do these things. So I thought that I could do everything under the sun. And I learned that lesson. That I can't.
What was your plan going into that? Because I'm just trying to do the logistics, right? So if you're treating somebody, right, I assume it's going to be, in a separate room, so you're not able to see the floor.
Yeah.
I hope that assumption's right, because it'd be really hard to fucking treat somebody with all this other shit's going on. So is that where the partner came in? Like because you can't be 2 places at one time, and that sounds like a situation where you have to be 2 places at one time.
Yeah. I thought that I would figure all this out, and part of it was there were
It's
4.
not necessarily a bad thing.
Yeah, it didn't work though.
Yeah. Well, most things don't.
Right. So there were 4 of us partners, and I thought between the 4, and we got 12,000 square feet right from the start, in New Jersey. And New Jersey is very expensive. So I thought that we could figure this out, and we'll get teams. And so the two of the partners would be leading the classes. Me and the other guy would be the primary business people, and that we would all figure this out. But as a team, we just did not have good communication. We did not have good leadership. None of us were doing our roles well.
Were there any business people out of these 4?
We thought that the guy who my dad grabbed would be the one. He was an executive in Deloitte, made a lot of money, and he would come in and be like, I'm going to be the business guy. And whether we gave him a chance or not.
Dave Tate here from Elite FTS to talk to you about bands. We've been a supplier of bands for almost 2 decades now. So I've known my way around the band landscape. When I'm talking about bands, I'm talking about floss bands, long bands, short bands, bands you can use for resistance training, mobility training, body weight training, and flossing. One of our most popular bands, or actually our most popular bands, are the long bands. The long bands are typically used the most with squats, bench presses. Our floss bands are bands that you wrap around the joint to be able to help with mobility, circulation. And the short bands are designed for shorter range movements, bench press, deadlifts, and a lot of times people will use them with resistance machines to help accommodate the strength resistance curve. Head over to elitefts.com and look for bands in the toolbar or blowout menu.
But it didn't work out.
I'm just trying to do the math in my head, because when you boil this down, to anybody that knows business, there's a difference between revenue, gross income, and net.
Mm-hmm.
Like once you get down to the net in most businesses, it's not what people think it ever is. And with 4 people sharing the net, even if it's doing very well, that's in Jersey, man, that's probably still not even enough to get by.
we didn't make.
You didn't look at any projections or
I mean,
anything?
at first we were paying ourselves $2,000 a month. At the beginning, we had a cushion, and then very quickly, all that cushion was gone, and then we stopped paying ourselves, and then we paid the two people who had some type of income, just a little bit of money, and then all of a sudden there was like no money, and then we were just in debt, and then it was a complete shit show.
Yeah.
So,
What were the biggest takeaways from just business that you took away from that you would suggest to somebody now?
I mean,
Because you learn from all of this, right? All
Yeah,
the
big
bad.
time.
We learn more from the bad than we ever do the good.
yeah. Well, one of the big things is strategy and being sequential about your steps. So I could have gotten the practice off to a really good place and had people working for me, and then now I have energy and space and time, and I'm going to do this thing. So I could have been more sequential with that. And the other aspect, and why I met Bedros in 2019, was leadership. Was that I did not know how to communicate well or to get people to do whatever their role or responsibility was from a place of being able to get them to do things. And so knowing the strategy of how to organize everything in my head, but also how to communicate to people to get shit done was really important.
So the lessons that you learned, I'm trying to boil this back to being the captain and middle linebacker, right? Because that kind of puts you in the defensive prestige position, right? Quarterback, offense.
Yeah.
And the captain puts you in that leadership position.
Yeah.
But the other caveat is you have head coaches and position coaches, which are actually more of the leadership, but people are going to fall more on you to be, especially on the field, to make the audibles, to be able to make those decisions. Were you not able to connect the dots, or were you connecting the dots, but you were doing it in the aggressive way that had to be done on the field? It's like, motherfucker, you see, it's different. You can't do that in business.
Well, you can't.
Well, you can't. Well, you can, but
Yeah, I know.
There's
I
more
know.
effective
I know.
ways.
I know. I know.
Yeah.
You have to choose the person that you can do that with.
Yeah.
But I would say it was all of it. The other thing was with CrossFit, there's no system. What are you marketing? At that time, 2012, like everybody was opening CrossFit gym, then started dying off. Right before we closed, we were about to started getting into Alex Hormozy's stuff, which I have a friend who was also going to close, got into his system, and then he built 3 CrossFit gyms right after that. So I think that was part of it, is having enough leads. We were delivering a great CrossFit product to the extent that it could be delivered well. We got old people working out, 65. We had a light program for older people. My dad was working out. He looked amazing and great. So the product was great from a CrossFit perspective. We weren't getting enough leads in for 12,000 square feet. And then we weren't doing whatever the things were necessary in order to really leverage ourselves in that space.
So what happened after that?
Closed the gym. Very humbling. I moved our practice to another spot, and then that was 2018, and I was like, okay, what did I learn from this? If I want to be world class at one thing, I probably shouldn't be diversifying my energy, space, and time into other things. So I really just doubled down on the manual therapy work. And I said, okay, there are 3,000 chiropractors in New Jersey, 8,000 massage therapists, 9,000 PTs. A lot of these people are doing strength and rehab stuff. And Jim Collins talks about the hedgehog concept, I believe. It's from good to great. And it's like, if you can be the best in the world at something that has an economic engine that you really love to do, where does that fit? And so I already saw with my mentor that there were like 30 or 40 manual therapists trying to be really good at this. And I was like, with this adhesion stuff, there's almost no one doing it. And from my perspective, the chronic pain market is gigantic, which make this a really good business proposition. So if I focus on just being manual therapy, then I could be world class at this, have a really strong economic engine. And then when January 2023, when we started adhesion release methods, I could also teach other doctors and therapists to do this. And it's very, very needed. All of our patients have had pain at least with 6 months, seen at least 3 doctor or therapists. That's how we qualify our patients. So if we're making money, that means that we're helping people that those people would be lost. They'd be done. They'd be lost. So I saw the opportunity and I was like, okay, I'm just going to focus on this manual therapy stuff and I'm going to become world class at it. And now we have people fly in from all across the country or Canada or Europe or Central America. And so it's paying off at 41 years of age.
So remind me of the date again when that CrossFit closed and you went out on your own?
2018.
All right. So then 2 years later, everything gets shut down. So how did you navigate that?
I didn't shut down one day. I'm very proud of that. I want my sons to know that. We just kept going. It was rough that year because 40% of our patient volume dropped out, and I hired 4 doctors that previous year, which was also not smart. But we just kept chipping away, putting one foot in front of the other. At that time, I had done the project with Bedros, the Modern Day Night Project. So that was 2019-20. So I had undergone a bunch of his mentorship. And he's like, guys, this is wartime. You put one foot in front of the other every day. And I already learned this in football too. You get your ass knocked down, you get back up. So I just did what I always did, and I didn't give up. And I just kept going. We didn't close for one day during COVID. And we just built back up until our people started coming back in, and then we were okay.
Well, at that time you were full practitioner, right? So would you have been seen as, what do they call it, essential, where the gym would not be?
To be honest, I don't necessarily know, and I'm not good with rules.
Yeah.
I think we would have been seen as okay. Yeah, I believe we would have been seen as okay if somebody.
Well, you would know
anything.
if not, because somebody would. I mean, you were in Jersey, man. Somebody would have reported.
Probably.
Yeah.
Yeah, probably. Yeah, we just kept going.
All right. So then, when did you decide to branch this out and teach other people the methods?
Yeah.
Or when did you know that your skill level was to a point? Because there's 2 things that have to happen here. Your skill level has to be to a point that's solid enough, right, to be able to do that. And then you have to be able to have the ability to teach this.
Yeah.
You know, those are 2 different skill sets.
Yeah. Over the years, I had seen that I was probably in the top 5 to 8 people who had trained extremely frequently with a certain group of guys with my mentor. So I had seen who was showing up and who wasn't showing up. So I saw all the same guys all the time, and then I saw all these other people come here or there. And I was like, okay, I'm probably in the top 5 to 8 guys. And then you're doing repetitions on people and you're constantly giving feedback and judging. And I'm like, okay, I'm fairly okay with this. And so I talked to the people who were ahead of me at the time when Dr. Brady retired in 2020. And I said, who's carrying the torch forward? Because somebody has to. The world needs this care. There's a huge opportunity. No one's teaching the system of diagnosing and treating adhesion. So who's going to do this? And at the time, no one wanted to do it. And so I said, fuck, that leaves me. And I'm typically the type of person who's very service oriented and wants to. I'm utilitarian. Like, what's the greatest value that this meat suit can provide for the world? And so I was like, okay, I suppose that I have to do it. And again, I talked with Bedros at the time. I hired him for his year coaching, and I explained to him all this, and he's like, you have to do this. Like, you don't have a choice. You know what you know. You see what you see. Nobody else is going to step up to the plate. There are all these people in chronic pain. Let's fucking go. And so I did.
What's curious to me is, I don't want to put names out there, but I know practitioners and other disciplines that are older that have developed their styles and techniques, and they get to this point to where they see their own mortality, right? Mm-hmm. And they want to have, they're looking for other people to carry the torch, mm-hmm. right? And what they'll tell me is they're frustrated. There's fucking nobody out there to do it, right?
Yeah.
And I've heard it from 4 different ones that the same story, you know, across the board. Some have certifications, some don't. Same thing.
Yeah.
Where what about you made you say, I'm going to pick up this torch? Because you just said nobody else is really willing to do it, right?
Yeah.
Which means that they all have fear or whatever reasons,
Yeah.
you know, that to not do it, right?
Yeah.
Because and I got a different type of mindset, but like, why would you not? You know, it's like, it seems like this great opportunity,
Right.
because the groundwork's kind of set. I mean, things need to change, be updated, all these other things, but the path, it's not like you're cutting a brand new path. It's kind of like, you can see, you know, so was it Bedros, or, I mean, how did you make this decision where it's not the easiest choice, because, you know, it's going to be way more work, you know, to be able to do that, right? Because it's now a whole other skill that you have to be able to learn on that. So it's, why you instead of any of the other people?
Yeah, so one of the reasons Dr. Brady retired was he found it too difficult and too hard to get new providers in.
Yes.
So I was aware and knew of this. But what I also know about myself is that I'm willing to bang my head against the wall and suffer for longer periods of time than most human beings. And even now, I still struggle with depression stuff, and to treat patients 7 hours a day, to be running the practice, to be continuing to lead adhesion release methods. I'm currently doing a lot of the social media and a lot of the sales stuff. I'm not doing the things that like really light me up. I'm not as present for my sons as I want to be, which kills me. I'm not as present for my partner Katie as I want to be. I have to be really careful. But I see the opportunity for what I'm building, and the opportunity and the vision of what this could be, frankly, revolutionizing chronic pain healthcare trumps the costs and the suffering that I think it would go through. So I think that I'm willing to put my shit aside for a period of time and a while in order to get things done, because I want to serve in a specific way. And I feel like I'm on borrowed time. I don't feel like I'm supposed to be here. And so me being here, it's not about just being here and, you know, throwing flowers around and just whatever for myself. Like, I'm here to serve. I'm here to serve. So what's the best possible way that I can serve in order to have impact? And so this adhesion release method is teaching other providers. I love treating patients. It's a lot on me as an introvert, but if I can get one provider who every year is going to help 200 new people in chronic pain get better, and then I get 10, and right now we have maybe 40-ish in the past 3 to 4 years, but in 5 or 10 years, if I can have 100, but every single person I think about, like, whenever they share one success story, it's just fuel in my engine. Mm-hmm. It's just fuel in my engine. I want impact. And so that impact it's what feeds me. It's what keeps me going.
I think with a lot of the practitioners that I was speaking about, mm-hmm. and this will cross over even into leaders of different training programs or whatever it's going to be, is especially when you're in the health and fitness space, this would be ageism or whatever they want to call that. I think if you get to a certain age, it's harder to be able to pull in people that's going to want to follow or get certified or whatever it's going to be. There's definitely a gap there where if you can fill in, you know, somebody is that in between, that message still the same, but is framed differently in a different suit to go to a different demographic, which is going to be easier for the demographic they need to be able to relate to it. And I think that's where a lot of these kind of get lost, is they wait too long, right? And then when they wait too long, it becomes hard to get somebody else to carry the torch, because the people that they're trying to, this is the craziest thing, the people that they're trying to get the torch are no different than what they were when they were their age. And they're looking at them like, dude, you don't get it, right? I don't want to take your torch because you don't get it. You don't get how we think, right? Which means the people underneath you know, don't get how you think, right? And that it's too big of a divide, you know, to be able to bridge, you know, with all that. So stepping into that role, you know, you step into that, but it's the messaging is a little better because the suit's better, right? The gap's less, but it's still going to happen, you know, as you get older. You know, the thing is to bring in the other people. And when you're leading from service, which if it's truly from service, then I don't want to say it's impossible to fail. You can always succeed. It may not be the success that it's not the success that a lot of people will think it will be,
right?
But it's still that success, because when you lead with service, it's always going to be there,
right?
And all the other stuff kind of works its way out, but you're kind of figuring out that there's a lot of shit. And this is the interesting thing that I've always had with the mentorship market is delegate, you know, delegate this, delegate that. And it's like, motherfucker, do you understand? You know, it's what may take me an hour or 2 hours to do, somebody else is going to want to be compensated, you know, 30 hours a week to be able to do. And then where's that money come from? Right. And that's one of my biggest frustrations with just business advice is this delegate. Delegate, you know, and how, right? To whom, right? And a lot of things you do, I mean, you do realize that you go through, but their sales pitch on that message is, well, if you delegate, then you can use that time and be able to monetize that time at a higher value than what you're delegating out. And it's like, no, I can't, right? Because that time's probably just going to go to family and, you know, just chilling the fuck out, you know, for all that. And then it still only takes me 5 hours a week. And I'm sure you've had this banter with Bedros and all these other things. It still only takes 5 hours a week. It's like, motherfucker, just delegate it out. And it's like, no, motherfucker. It's, you know, they don't, they get too far removed, right? Because they're in a position to where everything can be delegated out, but it becomes this process of it's a process of elimination, not delegation. It's like, what are the things that you're doing that you don't even need to be doing? Right? That's the big one. Because you'll find out that if I just quit doing this, there's no change in revenue. There's no change in server. I'm just doing this because I like to do this and I feel busy. Then you knock it all out and it's like, oh shit, you know, then it kind of moves from there.
I agree.
Have you been seeing that?
That's a really hard lesson to learn. But I have seen it. And I mean, I'm a workaholic. So my partner Katie's broken up with me a bunch of times over the past 10 years. And the last time was rough. And one of my therapists told me at the time that it would be really hard for an alcoholic to continue to go to bars all the time and not be expected to drink. So the game that I've been having to play is I'm a workaholic and I'm in this work environment now, and financially things have kind of been rough over the past few years. She's been sick. We're sending our boys to a nature school in New Jersey because my son Bear in kindergarten was already having behavioral issues sitting in chairs. So they're way happier in the school. A lot of different reasons for that. And so things were tough. And so I'm having to be in this work environment where I have enormous demand on me. I have to be present for my family. I have to figure things out. So just by necessity, I have to let things drop and go because I don't have enough hands to keep all the balls up in the air. So in the past few months, I keep telling people there are certain balls that are just getting dropped, and I just apologize to them. I'm sorry. I'm just like, I'm doing everything I can to move this shit forward so that the practice adhesion release methods keeps going and it's not just all weighing on me. So I'm learning it the hard way, unfortunately, but the question goes back to the CrossFit thing. Is I learned about the strategy and the sequence of things, is that if I can get things to a certain point and I know what I'm delegating when I get to that point, then I can move things forward and give myself a little bit of breathing space. So that's the game that I'm playing now is like right now being here, if I can expose more the chronic pain market to where to find adhesion release methods providers, but more importantly for me is more manual therapists who want to specialize and become world class at manual therapy. That's the biggest problem that I currently have. So
How so?
it's really hard to find providers who actually want to do the work to become world class. When I do these phone consultations with manual therapists, they say that they want to fix chronic pain. They say they want the niche. They want to be the person to go to when they've been failed by 3 other doctor therapists. They say they want to double their income in a year. They say want to increase their rates. They want to shorten their treatment times from an hour to 30 minutes to 20 minutes to 50 minutes. They say all that. And then when I tell them, okay, you're going to train 4 to 6 times per year. You're studying every day. You're going to post your challenges and your cases on the Facebook group. You're going to pay right now. It's between $7,000 to $10,000 a year. How many of those people do you think want to continue?
Mm-hmm.
How many people say that they want to make a lot of money or they want to do this thing? This is human nature.
Yes, yes.
How many people say that they want to do shit, and then when it comes time to do that, actually do it? Peter Drucker said, show me somebody's bank account and their calendar, and I'll show you what their priorities are. So I talk to our providers about this. Like, you say you want to do this thing. Are you actually doing the behaviors that are actually going to lead to the outcome that you say that you want to achieve? So I'm in the process of, we have 40,000 followers on our Adhesion Release Methods Instagram. We have 2,000 on the Adhesion Release Methods YouTube. But I'm in the process of exposing more manual therapists to this so that we can find the right people who want to attend the Harvard of manual therapy, which is what we're framing ourselves as. But I need to do the work to show all the testimonials of our current providers and the results that they're getting so that they want to specialize in this, so that I can feed the enormous demand that we already have for this service. Because the demand, we get like 1,000 leads per month for somewhere in the world, them looking for this type of provider. I don't have the supply. I need the supply to serve the demand. There are some places like LA, Florida, Georgia for some reason, London, some Texas, Dallas. There are certain areas of the country where like every day we'll get 5 people DMing us on Instagram, who's the closest person. And so I have these enormous holes in the country where we don't have providers. And not only that, but some of these providers are very new. And we train 6 times a year because it's going to take 18 to 36, 72 trainings over the next 5 to 10 years to be able to get close to my level. Since I trained 24 times in 2015. I spent over 100,000 that year.
Mm-hmm.
So it's just, I'm asking a lot of manual therapists compared with what is currently out there. Like, this is a very dense, robust training system. And so people say that they want something, but when I say what they have to do to get there, how many people want to be elite as a powerlifter? How many people?
Well, you see that even in the what majority of your clients come to you, right? To where you'll say, "Hey, do this movement," right? You show me something. Do this movement every day.
Yeah.
How many are going to actually do that?
Yeah.
Right. So it's just the reality that it's a weird world, right?
Yeah.
Because I find myself not every day, but multiple times a week reminding people that the social media is not real.
Mm-hmm.
And when you just do the math of all that, it's like how many people are actually on social media, and then what percentage of those people actually post, right? There's a big giant percentage on, right, but most are just lurkers, right, and don't care to post or actually say anything, or, have private accounts and all this other kind of stuff. But yet we're going to frame our opinion based upon the smallest minority in any demographic that does post and does do all this other stuff, such as you can make $40,000 a month by doing X or whatever it's going to be. And then they think this shit's real, right? Even if it's political or whatever, like none of this shit is real.
Yeah.
Right. It's all manufactured, or it's all influence, right? That's the word influencer, which is funny because the influencers want to be the influencers so they can be able to make money, but they don't understand they're also being influenced, and everybody's being influenced. But when you step out of that and you're doing one of your clinics, or you're going to somebody else's clinic, or you're traveling, right, none of what you see in the real world is what you see there. It's not, it's like fucking TV before we had social media. You'd watch TV and you knew it was not real. Right. Like all the TV shows aren't real, like Cops. Well, maybe Cops was, I don't fucking know. Yeah. But whatever TV shows were on at the time, I didn't pay attention. It's not real. But there's that weird, that disconnect. Yeah. And when people are reminded I'm not even reminded, but just like open your fucking eyes, when then they see it, because it still takes work.
Right.
That's the biggest, one of the biggest lies that I've seen over my whole time in business, is that there's always an easier way. It's like, motherfucker, there's not.
Right.
There's more pain, there's more adversity than there is success, whatever you want to call that.
Yeah.
You have to find the success in the pain and the adversity.
Yeah.
I don't like that, the enjoy the journey shit, but there's gaps.
Yes.
There's small gaps between adverse shit, right?
Yeah.
You just got to figure out how to use those gaps and embrace them.
Yeah.
This is cool.
Yeah.
Like nothing's fucking up. Like we've been talking for, I don't know, an hour and a half, whatever. Nothing's fucking up that I know about. This is cool. Like it's why I like doing the podcast.
Right.
Like, nothing's fucking up. So you enjoy those gaps.
Yes.
Where that's kind of the key, is to be able to understand that, then be able to enjoy the gaps.
Yeah.
And, if you can predict the next thing that's going to happen, that's great. None of us can, but the odd thing is when you look back, because you've been through all this, when you look back, there's lessons from all those.
Yeah.
And the older you get, the more you realize it wasn't that bad.
Right.
And it wasn't that bad. Why? Because something even fucking worse happened later. which plays out all the way through, which should tell us in the future something even worse is going to come than anything that you've ever seen. But if you're calloused enough, this is kind of opposite of what you do, right? Like if you build up enough adhesions, right, then it's not going to hurt. It's going to be perceived differently.
Yeah.
Right. What I've learned is that perception's the biggest thing. Like reframing shit. Like I've heard you say a few times throughout this thing that you're an introvert. No, you have introverted tendencies.
Sure.
Right. Because you're not an introvert if you're teaching a course.
Yeah.
You're not an introvert sitting on a podcast.
Yeah. You're
not an introvert, if you're making a post. It doesn't mean that you enjoy it.
Right.
Right. But it's not. We all know true introverts.
Yeah.
They don't leave their house. They live in the basement. They play video games and they make troll posts on shit all the time.
Yeah.
Right.
Yeah.
So where do you kind of see it going from, like you said, you're working towards this point, and in that point, you're going to be at this position to be able to delegate, do whatever other stuff is. What is that point?
I view myself, I'm the steward of this baby that's currently adhesion release method. So I really like that word, because I feel like I'm just holding this until the next best person or the proper leadership comes in place. Maybe it's me, but what I've talked to with our providers and our instructors that we're developing this year is like, if somebody better than me comes on board for this, I want the best person leading this needs to be leading this, because this is that important. So I'm working to steward this in a way that moves things forward. So I mean, right now we're developing our instructor team this year. Last year I hired an HR consultant who, him and his partner, they developed, they worked on a coaching business and grew it to 10 million gross per year. One of them is very skilled at developing accredited curriculums. So we are refining our curriculum to make it more robust and dense and make it something that could maybe someday could even become a massage therapy school or some other type of school, and to develop the team so that there's no key man risk on me and if something happens to me, but the team is what's carrying this forward. And we develop a hierarchy where me, the instructors, the leadership team, providers, like I tell all the providers, like, all of you should be teaching in 10 years. There's no reason why you shouldn't be. We have 40 of us right now. So this is what you could or should be working towards. So I'm really trying to step back and view all of this from a systems and a strategy perspective. What decisions do I need to make now so that 10 years from now, this is what the vision is? So everything is about what this baby matures and develops into, and what are the decisions that I have to make to get there. I didn't have to hire this education consultant right now at year 4. I don't have the finances for it, but it feels like the right decision to make. to make sure that the curriculum and the education is as top notch as can be, so that we can build on top of this, make sure all the providers are being developed in as high a degree as we can develop them, in order so 10 years from now we have, I'd love to have 500 providers in 10 years. The goal we set is that 30 years from now, so I'll be 71, 50 million people are able to get out of chronic pain from an adhesion release methods perspective. That used to be the amount of chronic pain in the United States. I think now it's around 78 million. But that would mean that we need about 5,000 providers. But there's way more hands-on feel than just 200 people in an ART seminar. Like, we have a 6-to-1 provider to instructor ratio at a training. I need a shit ton of instructors to be able to develop the feel of those providers in order to help revolutionize chronic pain. So it's really developing the systems and the infrastructure. I don't know if you're a Seth Godin fan. His last book, are you familiar with him? His last book, I think This Is Strategy, was so helpful for me because it just helped me see how to develop this thing in the sequential way that I've mentioned a few times already. So it's getting the team, getting the curriculum on board, and then exposing this out to as many people as I can to show people what's possible, especially from exposing manual therapists.
So when we go down a different lane here, and we look at the people who are coming in to see you or your providers, what are the most common? Because there's different buckets of people, right? If I'm working with lifters, it's like there's the ones that can't brace for shit. There's the one that can't hinge for shit. There's different buckets. What are the most common outside of back, right? Because the default is always going to be the lower back, and that's actually, let's talk about that, right? Because the back can be this default, right? Because everybody's got fucked up lower backs, right? And it's pick anything out of the air and we can find a cause.
Yeah.
Right. And it's how they sit, how they move, it's a million fucking things, right? That kind of go into that, where that it also puts that person into a very precarious position because their lower back's fucked up. Somebody see a chiropractor or do this, do the McGill Big Three. There's so many things that they do nothing, right? So with that, how do you go about the diagnosis to be able to know? Because most of the time, I'm going to assume most of the time when they come in, they've not had any imaging. The most they've ever had is an X-ray. Then somebody said, "Look, you got scoliosis," which yeah, great. But most people do, But that becomes the number of times I've heard that, become this. Oh my God, I'm fucked for the rest of my life because of scoliosis, and like all this kind of stuff. So, with how do you go about the diagnostics of that?
The first part of that, from my perspective, this goes across all healthcare, is patient selection. I would love to see this happen with stem cells because a lot of people talk great stuff about stem cells. I've seen some people get great results from stem cells. I've seen a lot of people not get any results from stem cells and fly down to Colombia and get whatever. My question is who are the clients who are doing amazingly well with stem cells? And then what are those qualifiers so that we can steer the right people towards that type of treatment? So I think that's the first step. Our qualifiers are generally 30 to 60 years old, pain over 6 months, seen at least 3 doctors or therapists without relief. I want people to try chiro, PT, rehab, strengthening, acupuncture. They can try cortisone shots if they want. Probably not surgery yet. I want them to try all that stuff because those are the people that we're going to do really well with. And with those people, that's a promise that I don't see anybody else being able to deliver on that promise like we can. So just in patient selection or client selection, that is a huge part of the process, so that when people know, how might people know that they need adhesion release methods? Those are the qualifiers. 30 to 60 years old, pain over 6 months, seen at least 3 doctors or therapists without relief. But the next step of it is we do this history, kind of like we did for you, and we're trying to determine if their pain is musculoskeletal and if it sounds like adhesion might be related. The simplest way to determine that is, first, musculoskeletal, is your pain worse or better with a movement or a posture? So I talked to a woman from California. She had some stomach issues. She was going to fly out to New Jersey. Her stomach symptoms didn't get any better or worse with moving or activity. I was like, don't fly out to New Jersey. Maybe if you were in my town, like, come and do an exam, but I don't think it's worth it for you. So that's how you determine if it's musculoskeletal. But generally speaking, I mean, that also will address most adhesion, because adhesion is the most common condition in the musculoskeletal system.
Hey guys, if you're enjoying what you're watching, make sure to take a moment to like, comment, and subscribe.
But is it worse with a certain amount of load or at a specific activity, or worse with a certain range of motion? That's generally how we're determining if there's adhesion, but also what the other diagnostic pieces are. So just in you telling me that it's a deep ache in the middle of your shoulder, that alone is giving me an indicator that it's likely the glenohumeral joint / labrum.
So if we back up, then how is the adhesion being laid down?
Yes. Adhesion forms from trauma or overuse. People understand trauma as scar tissue. That's one way. So you literally have a scar, and then that's what adhesion's made out of. Or you get in a car accident and you have extreme whiplash, and then you have adhesion from the trauma. But the more common way that adhesion forms is overuse. And overuse is your tissue being loaded more than the capacity can handle. So when it's overloaded, what happens is, let's say it's a muscle, let's say you do bench press 7 days a week. I did the Smolov squat program in like 2015. It was 4 days of heavy squatting. I got my 1 rep max to over 350. That was big for me. And I was in the second phase, way too much load. So I tore my labrum in my hip. But injuries happen when load exceeds capacity. So when you overload a muscle, it shortens down. There's restricted blood flow when it shortens down. There's an inflammatory response. These cells called fibroblasts come, they lay down collagen or adhesion. Free radicals form in the middle of there too. It's causing damage. That's where the fibroblasts come after the free radicals are there. So the body puts down this collagen, a connective tissue, as a protective response. So it's caused by overuse or friction, and the body's doing it as a smart response to kind of splint itself.
Yes. So as that's there, and sometimes it's there without the person knowing, right? I'm sure
Most of the time
it's there without them knowing. So with that being said, compensation patterns are starting to develop, right? With that. So it's going to, so when you're able to break down or release, a lot of these adhesions, and now you have this regained range of motion. This is kind of getting back to what I alluded to when you were working on me, is there's other things going on now, right? To where you have this restored pattern, which doesn't need the compensation, but the compensation's been happening for so long that the motor units are kind of used to that. So now it's like, oh shit, what are we supposed to do now that this is here? And you have this increased range of motion, which you're going to want to load, right? But you want to be kind of cautious on how you're going to load that, right? So with those two things in mind, what are the next steps?
So it depends how degenerated somebody is, but the younger somebody is, I think a lot of neuromuscular rehabilitation is unnecessary when you actually treat the exact entrapment site that is causing their problems. This especially relates to adhesions around peripheral nerves. And most of the adhesions that we treat with adhesion release methods providers, because they're directly linked with chronic pain, are peripheral nerve entrapments. So we're adhesion specialists and muscles, but we treat nerves more than we treat anything else. So if you have somebody who's got some funky thing doing a press or a bench press or a deadlift or a squat or whatever, and you treat the right entrapment site, you could do 1 or 2 passes and then it's better, and there's no training that's necessary. Now, if something hasn't been used for a while and it hasn't been recruited to activate in a while, then you could have some loading that's necessary in order to bring it up to speed. And so the question is just, how do you load it best? Do you isolate it? Do you do some type of complex movement? Do you do whatever? Generally speaking, it should be done in a slower and sustainable way so things can acclimate and so that you don't overload something else, especially like a joint, too fast, but also so that you can listen to your body to see where you're at. Because what we'll do, let's say somebody is a runner and they run a mile and then they have Achilles pain. It's 5 out of 10. It's 5 out of 10 after a mile. And so we fix some stuff and we say, okay, you're going to go and do a test. You're going to do a mile. And they're like, okay, I had no symptoms. I did a mile. Okay, great. Now let's do a mile and a half. It's a stair step up. And the goal with that is I want to see where you're at. What some people do is they'll they're good after a mile and they're like, okay, I'm doing 12 miles now. And so the problem with that is they're likely going to have symptoms. And when they do have symptoms, they're not going to know where their previous capacity was at in order to train in a way to build things up in a smart way. So the stair stepping of loading is helpful for testing and awareness for what capacity is at, but also to help acclimate tissues in a more productive way so that we ultimately set ourselves up to do the thing that we want to do, not just for the next 1 to 3 months or something till we injure ourselves again, but 5, 10, 20, 30 years down the road.
Where would you put something like loaded stretching or isometrics within that newly gained range of motion?
Yeah, so I mean, isometrics, that has value because it's going to strengthen the tissue that hasn't been used in a way that allows it to start get up to speed. I'm not sure about the stretching aspect. There's likely value with the stretching. I think I'm more a fan of figuring out how to strengthen load and bring activation to tissue than I am of stretching.
Well, I put those in there because I wonder how with the demographic that's going to put training as one of the top 3 priorities, right? Granted, time, right, is going to build adhesions no matter what we all say, right? So that's one culprit there. But I wonder how a lot of these things happen in the first place, right? And in the powerlifting community, to me, it seems pretty obvious because if it's a bench press, you're trying to find a way to limit that range of motion to the shortest range of motion that's illegal to be the lift past.
Yes.
You can say even a legal depth squat is still not truly a deep squat, because it's parallel. And so if they live in these zones, all the time, and then they're loading those zones all the time, then a lot of the other joints are never being trained through a full range of motion. Yes. When something breaks, and so they're kind of setting, any sport would do this, right? Because any sport's going to have repetitive movement patterns which all stay within that sport, which is kind of where this whole functional training shit comes in. Is you got to train outside of the movement patterns of your sport, thus you need to do all this other shit, which if you do that way too much, it's just going to make you suck at your main sport. Because now you're not doing your main. So there's a balance. It falls in there. And so within the training community, I see that as kind of being one of the culprits that in some cases, it's kind of pretty simple to me. You just do a down set, with a lighter weight, making sure that you're expressing the fullest range of motion that you can possibly do. Or if you bench press all the time, maybe every now and again do push-ups to where the shoulder blades can actually fucking, rotate. Just things of that sort. Do you see those same things?
Yeah. So, I really like what Charles Poliquin did with the strength ratios. I know that my buddy Dr. Sean Pastuch of Active Life RX and then my friend Corey Duvall in Asheville Stay Active Clinic, those strength ratios they make a lot of sense to me. So I'm not an expert in powerlifting, so I don't know like how much. It makes sense to me that if somebody has a proper strength ratio, they should be stronger than somebody who doesn't, or have more longevity than somebody who doesn't have that proper strength ratio. But if a proper strength ratio is in place, they should develop less adhesion or be at less risk of a joint problem or injury or joint degeneration because the tissue is going to pull. the load's going to be balanced. And if the load is balanced across, if you have a whole joint or surface area, and you could have the load balanced across the entire circumference of the surface area versus being on over half because your quad is being recruited more than your hamstring, that's going to set you up for less joint risk and also less adhesion risk. So it's, for me, how do you use all of the musculature that you have and bring things up to speed in a way that allows you to be safer? That's what makes the most sense to me as far as minimizing adhesion development.
So with your intake process, do you need to know that beforehand, or can you find that with the testing that you're doing?
I don't necessarily need to know that for my purposes, but I think there are other people who, the two individuals I just mentioned, Corey and Sean, would be better people to do that stuff. That's not my wheelhouse. I don't need that information or data in order to figure out where the adhesions are and to make somebody's symptoms better. But I think big picture, it feels necessary to me to perform better and have more longevity.
You had a couple topics down here that you wanted to talk about. Some we touched on, but I have dark stories and mental health, which like 2 out of the 4 that you put in there, that's 50%.
Yeah.
So what did you want to speak on about that?
I'm asking also why I'm here, and I feel like I said I've struggled with this depression, shame stuff, but
how does that manifest in you? Because when people will say, a lot of I'm a definition guy, right? So if somebody says depression, let me back up a second. If somebody says they work hard, right? What does that mean? Like, your level of working hard is going to be different than my level and everybody else. It's very subjective.
Yeah.
Right. Depression seems to be this term that, even though it is medically a diagnosis, it's very subjective.
Yeah.
So when somebody mentions something like that, I like to ask, how does that manifest in them?
Yes. I think there are a few different ways for me. One of the ways it manifests is, so when I say I'm a workaholic, I'm ignoring signals that tell me when I need to recover. It's, if you give somebody to do 5 sets of bench press or whatever, and you see them and they're doing like 10, 15, 20 sets, and you ask them what they're doing and they're like, oh, I don't know what's going on. I feel like that's what happens with me sometimes, is I'm ignoring signals to stop. And then what ends up happening is, I've been feeling better the past couple months because I'm on some supplements that are really helping me. But every 3 to 4 weeks, I hit a wall. I get really tired. Then I notice that any high level thinking goes out through the door. When I'm at home, I don't want to do anything. And I'll sit in a specific couch and I'll stare at the wall for an hour. And like, why am I staring at the wall? I don't know what else to do with myself. I can't think of it. There's nothing that I can think of that would help. I still smoke cannabis a little bit here or there. I used to smoke like 2 or 3 days a week. I've really tried not to do that.
So then you're staring at the wall for 4 hours?
But then I'm seeing rainbows and
yeah.
No, but at least now I try to just, I'm feeling really shitty and I'm just going to sit in this fire and I'm just going to feel whatever I have to feel, and I'm going to try to understand what's going on. I just figured this part out with the fatigue, the workaholism, the fatigue, and then the mind shutting off like a year and a half ago. So that's one way that manifests. Another way recently is that I've noticed specific shame spirals that I haven't been able to get myself out of, where I'm like, you're a worthless piece of shit. You're not providing value. And then that causes a certain state where I don't feel like I'm ever going to achieve the goals that I want to achieve. And when I feel like I can't achieve those things and I feel like I'm just going to fail at any of the things that I want to do, it's not fun to not win ever. And so this is a sick way of thinking, because I would say that I'm here. Mm-hmm. We help a lot of people every day. I have all this stuff, but the conditioning that I did as a kid planted some seeds in there that sometimes I'm surprised that I'm still dealing with this shit. So that's another way that it comes out. And And then some of it is just the thoughts of like, fuck you, Chris, I wish you were dead. Like that's what I used to write on my walls all the time in high school. Or so some of it feels like it could be hormonal and all that exercise could make it feel better. If I walk outside or if I'm in the sun for like 4 hours, that would make it feel better. So it comes out all these different ways. But what I think one of the themes of like who Chris is and why he's here is around suffering and healing. And there are a lot of different ways that affects different people. And I would argue that a lot of people who do there's one person who does things that they love. They really love it, but they're also okay if they don't do it. But I think there are a lot of people in powerlifting, in football and fitness, in work, that if they don't do that thing, shit's not okay. Like,
Yeah.
so if this is a game for someone, I'll have a patients do this, that they want to go and run, or they want to go and they want to do their thing, and they're hurt and they can't do it. And they come in here. Look, okay, we're not ready to run and lift. We can't do that yet. I need you to sit down, and when you feel like you would be going out to go on a run and lift, I need you to close your eyes and take some deep breaths, and I need you to feel into your body, sensation-wise, what's going on there, into your emotions, what you're feeling and what you're thinking, as far as what is present that has caused you to find this thing that you love, that is an outlet for you, that you want to do, but anchor into that and learn about yourself and understand what your patterns are. Because when I hurt myself deadlifting in 2014 at 6 in the morning, I was pissed off about something. I was like, I'm going to go and deadlift a shit ton. I herniated my disc for the first time. And then I hurt my hip soon after that, and I couldn't work out for a couple years. That's when I had that identity conversation. I was like, oh, fitness and football is the side for me. I was like, who am I? What do I do? And there was a lot of pain there for me, like enormous amount of pain. And so I started sifting through that. That's about when I started doing psychedelics, which really helped me observe my patterns. But I noticed that it helped me with my mood, and it helped me with some of my pain around just dealing with my shame of self-worth issues, that I didn't feel like I'm worthy. And it also allowed me to develop other patterns that gave me an outlet again when that I wasn't feeling good and present. And so now I'll meditate for 45 to 60 minutes a day. I still like different substances. I try to do substances in ceremonies because there's a framing and a structure around it to integrate, and it feels more healthy to do it than me and going and drinking a handle of vodka, or just smoking pot until I can't move and I'm sleeping. So I try to do the ceremonies in that way. But the meditation, I'll try to walk outside 3 hours a day if I can, even when it's frigid, because I notice that if I'm just present, I'm looking at the trees, I'm looking at nature, I'm looking all this stuff, I feel like I feel better. But 5 years ago, if you told me that walking would be an outlet for me, I'd be like, fuck you. Yeah. I need to go and do a WOD, a CrossFit workout or whatever. But now I've calmed myself down enough to be able to find some type of peace with that.
I think finding framing, just ways to reframe is what I've learned over my life with pretty much everything. Because when you talk about self-worth, I used to think there was a certain demographic of people that did feel that they were good enough. Then I realized that those group of people were narcissists, and they're narcissists because they don't feel like they're good enough, which basically means everybody doesn't feel like they're good enough, if they're being completely honest, which means the people that are getting their, in this spiral of feeling like they're not good enough or no different than all other people, which means if they're not different than all other people, then all other people then you are good enough. Because everybody falls into that same bucket. So everybody is essentially good enough, right? Where at the same time, that can be a driver, right? Because that feeling not at deep levels, at that surface level, makes you work. It makes you strive. It makes you go after. It's the football player, right? That makes you kind of go there. But it's being able to, and the psychedelics and all this may have helped you to be able to reframe those things, to be able to see that, I am good enough, right? I mean, you can go on the other end and say, I know I'm good enough because look at these fucking people, right? And you can always point to other ones that aren't, and then you're judging, which is even worse, because when you start judging those other people, then you're going to look to the people that you think are better, and then you're right back into that spiral of just reframing it. And for me, it's always been understanding that nobody thinks that they're good enough.
Right.
And if they do, you see what I'm saying? If they do, then they're narcissists.
Right.
And we all know why people are narcissists. And then that kind of plays into, all that with it, but it's real.
Yeah.
You know what I'm saying? And the good part is it's being discussed, more and more, because it's the social media it's not real.
Right.
So it makes people think, all these other things. And anybody that has their own business or anything like that, you're driven to a different level than other people are going to be. Otherwise you wouldn't do it, because you're doing something that is going to bring a lot of adversity. Maybe you don't know it at first.
Yeah.
Like at first you're like, oh, fuck yeah, this is the dream. And then, by the way, anybody that starts their own business, just be aware, as soon as you do that, all your friends and all the people around you they're going to support the shit out of it while you're talking about it. But then as soon as you do it, and then you're in business for 3, 4 months, 6 months, doesn't matter. You can be losing money out the ass. Everybody's going to think you're making at least 200 grand a year. So those are just givens that come along with all that. But people don't talk about it. So it's just kind of what's part of that whole mess that kind of plays into it, where I'm going to use what you just said and kind of turn that on its head, because when you're helping others, you're not going to feel that way.
Yeah, 100%.
Right? When somebody's self-absorbed and that's all they really care about, this is even with business, all they care about is money, 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 money. It's all self-absorbed, how they look and all this other kind of stuff. It's worse, it's worse, it's worse, it's worse. But when they're coming from trying to help other people, then it shifts.
Yeah.
Right? And the dicey thing there is you can help a whole lot of other people, but not financially be doing really well.
Yeah.
Right. And then and online you can help a whole lot of people, but you're never told because you're online.
Yeah.
So you don't know what the impact is.
Right.
I've had a number of coaches that I've known that were just all online, and then many of them do very well. So put that aside, but a lot of them end up being in these really dark places because yes, they are helping the clients. They're all getting better. They're all doing all this other stuff. But it's not like you when you had the CrossFit gym and you see that person break their PR and they're like, hey man, thank you. Right. The accolades are very far and few when you're online, very far and few, way less. And when you're in person, it's inverse. Yeah. Completely inverse. So I've seen a lot of like online coaches that go to in-person coaching and make way less, but are in a way better place because of just simple things. They see the client smile during the session. Yeah.
We need other people. I mean, that's part of human nature, is like we need to be around other people, and then you're able to see it better. But yeah. And on that note, Kobe Bryant, I don't know if you heard this story. He was like 8 years old, and his dad was like, I love you no matter what you do. And he was talking about how that gave him permission to be relentless about his basketball. And so similarly with the whole everybody's ashamed type thing or low self-worth, what I'm trying to do with my sons is I love you, God loves you, and when he does something, how does it feel to work so hard? Because what most parents do is, oh, you're so talented, or you're so skilled. So I'm just trying to separate those pieces of it and say, you are accepted and you're whole and complete and perfect the way you are, and we love you. There's nothing you can do wrong, and you work your ass off, right? And so I'm trying to set, like, I agree with you, and I think that I'm running the experiment to see if I can shift, like, if he's okay, and to separate, like, Kobe was loved, and then who he was this basketball player that outworked everybody. And what's fueling the work that we have to put in order to become world-class or master things.
The only caveat I would have to that is, were there players that worked harder than him that never made it to the NBA?
Of course.
Of course there were, right? So the only caveat is they have to be able to find gratification and satisfaction in that working hard and not having the
The
outcome,
achievements.
the
Yeah.
achievement, right? Because that's where the frustrations will come, especially if it's business or in sport, is, I worked my ass off. I know I worked harder than everybody else, but we still got beat. It's fucking life, dude. That's just the
Right.
way it is. And you can try again and work even harder and try again and work even harder and try again and work even harder. And it's still not going to happen.
Right.
Right. To where you have to find that peace and that success in that working hard
Right.
part, right? And when somebody's super driven, and I think this is where a lot of the identity crisis is, that they're super driven into that one thing. Then when that one thing's over, it's like everything falls
Right.
apart, and they don't realize that one thing, the things that when they look back, they're going to remember the most, that they're going to think of on their dying bed, isn't going to be those achievements. Right. It's going to be that drive,
right.
That passion to keep going and keep going and keep going,
right.
And not quit unless you have to quit, because it's the best option, which is, the don't quit speeches kind of frustrate me a little bit, because sometimes you could just be doing stupid shit all the time.
Right.
Just keep doing it. It doesn't work. If it doesn't work, pivot and kind of put it into something else. Were there other topics that you had that you wanted to go over I didn't bring up?
Protective tightness, I think, would be relevant to your audience. Most people are tight and think stretching or mobility, not realizing that the protective tightness is likely it could be coming from a joint that's protecting, but it's usually a nerve entrapment. So when you get the nerve entrapment immediately removed, often tightness can be sustainably removed. So for example, if somebody touches their toes and they feel calf tightness, that's coming from a sciatic nerve entrapment up higher. So I think one of the biggest areas, something I believe that I don't see across the industry in fitness or in pain care, is the idea of peripheral nerve entrapments, nerves glued by adhesion causing tightness. Because if you stretch a nerve more than 7 to 15%, it loses blood flow. And an EMG or NCV will catch a nerve that's damaged when it's like 90, 100% bad. But there's nothing catching it between being perfectly healthy, 0%, up to that 80 or 90%. And so the brain will contract a muscle to prevent that nerve from being lengthened, which is where that tightness is coming into play. So when you can release the nerve entrapment, you get flexibility and strength back, because now the nerve is not glued and tethered down in one spot or another, and that's what allows flexibility to be gained relatively quickly.
When you're talking about, it's like a chicken and egg thing, because the neural aspect of all this is coming more and more to light, as the years go by, right? Because you can look at that and say, well, is there just substances that you can take for the brain, that's going to release the nerve, right? And is it the brain causing the nerve, or is it the nerve causing the brain? It's like this chicken and egg thing, where the world that we live in now, you only have one option for the treatment, right? There's nothing that we know of yet, to be able to trigger that other one. But I bring this up because one thing when you go back to the ART and the muscle testing and everything I put in there, the muscle testing is just one thing, that applied kinesiology, that I just have never been able to fucking wrap my head around, right? Where I don't know if it's voodoo, I don't know what it is, right? Where I try to psych myself up, like, I don't get it, right? But you use the touching the toes as an example, to where I've had people work on me before, and, you can't touch your toes, and then, touch your nose, put your tongue in your fucking mouth, put your arm out, push this, and they push somewhere, and then I touch my toes. Like, the fuck is that? Like, how do you go about explaining what the hell that is?
There are a lot of neurological reflexes. I remember in chiropractic school, we used to have someone lie on their back. We used to I forget where it was, push somewhere in here and just put our finger here. And then all of a sudden, somebody's legs would just pop up. And we thought it was the coolest thing ever. We do it with this person, we do that person, that person. There are all these neurological reflexes that I don't have a good explanation for. Mm-hmm. What I will say is that if something doesn't last more than, You can do anything in 24 to 48 hours. If
Yeah.
something's not lasting more, the reflexes have died down by 24 to 48 hours. So what I care about is people having relief that's lasting. And so if something is not giving some type of sustained change after 24 48 hours, I don't really care to do it. Somebody might care to do it if it activates a bench press or something for a short period of time, but then they might have to be asking themselves, what's the cost of that if you're activating a reflex where you're bypassing the body's protective response.
Where that's, I meant to put this example out when we were talking earlier about after the treatment and you have the restrained or the regained range of motion is a couple times when I was still competing, I'd mentioned, I don't know if on this podcast or when we were doing the extra content, the reoccurring pec tears, is I would go see a practitioner. They would, do ART or whatever they did, Rolfing or whatever. And then that was a Monday, Wednesday, I go in to train max effort. Pec can't handle it, right? Because the adhesions were either broken down, not broken down, whatever it was going to be. But it wasn't enough time for the muscle to be able to handle the load that I was putting on there. But I'm thinking, fuck, it feels great. Everything's good to go. But then, boom, that happens there. So it's with those type of things, with what you're doing, what are there precautions like that to be able to kind of be wary of as this adhesions are being broken down?
My expectation for you is that if your movements and exercises aren't better, I immediately, today, tomorrow, the next day, besides there might be some soreness. Let's take the soreness out. So after the soreness goes away, if you're not immediately better, either I didn't remove any adhesions or I didn't remove enough adhesions. I wouldn't expect something to really drop off like that unless I remove so much adhesion that somebody needs to follow that sequential strengthening route and really. But usually when that happens is somebody's getting better. Every single visit, they're 15% better.
Yeah.
Visit 2, they're 15. Next visit, 30% better. Next visit, 50% better. Next visit, 75% better. Next visit, they come back and they're at square one. That is the case where they're just not strong enough and they need to strengthen and bring up capacity. I don't expect that for you.
No, I think what happened with me in the past with that is it would have been 30, 45 minutes just on the pack.
That's a lot.
You just tearing, what I'm saying?
That's a lot.
Just they would say just removing all the scar tissue, which you're not going to fucking do. But
the pec will fall off.
Yeah, exactly. I mean, and then I always thought, it's the only reason it's being held together is because of that. And I just kind of framed it as you did way too much, so
that's what it sounds like.
So it wasn't strong enough to be able to handle the load, which you're not doing that with what you're doing anyhow, because it's not that aggressive and that deep and that long, with that to where, I mean, those are like what you did today is not, to
One
me,
or two
it's not,
passes.
yeah,
per tissue.
yeah. So that's where some of the people you feel are making mistakes is they're spending way too much time and doing way too many passes on a certain area.
I would never dream at this point. I don't do more than 2 passes in a spot. So if you're doing more than 2 passes in one spot, what are we doing? Most of the time it's just 1 pass in a spot and immediately recheck it and it's better. So the manual therapy, there's a higher standard of outcomes and care that's available, which is what the principles that we teach our providers. So if somebody's having to do more than that, a manual therapist can do better than that.
Okay. How can somebody go about finding you? What's the best way to find you? We'll put all the links in the description, but I like to ask the best way.
Yeah, thank you. If anyone's in chronic pain, they've been to at least 3 other doctors, therapists, and they're curious about adhesion, they can go to www.findanadhesionprovider.com and not all of our providers are advanced. Some are intermediate, some are new, but we talk to all of our providers wherever you're at. If you're on the map, they have to train 4 to 6 times per year to be on our map, and they go on there after their second training. But I tell all the providers, you have to be in integrity with somebody, depending on where they're coming from and what you've treated before and what you can fix. If they're 5 minutes down the road, you've never treated their thing, and it's relatively cheap for them, just be honest about them. Don't overpromise anything. And our providers have been very good with this. So that's the best way where they can find help. If they want to contact me, at Barefoot Rehab on Instagram, at Dr. Chris Stepien on Instagram, and I'm also in the Adhesion Release Methods Instagram as well. And if anyone's in the New Jersey, New York area, they can come to Barefoot Rehab and I can help them.
Okay. Well, I want to thank you for coming out and working on me. Any final thoughts that you have?
I'm very grateful for your trust, and so it means a lot to me to have me here. No, I just really want people to be able to do things they love and not suffer in their, or life is suffering according to Buddhists, but suffer as little as needed.
All right. All right. Well, thank you guys, and we're done. All content you see on this channel and at elitefts.com is created by, take a guess, Elite FTS. If you want to help support the content, head over to elitefts.com and pick up literally anything that you need to be able to get more jacked and strong.